Next one is going to be crown hair transplant. And if you don't mind, save your questions to the end just so I make sure I stay on time. Because of little technical difficulties, we're slightly behind, but hopefully you're getting all the information you need. So crown transplantation, how do you explain something that people don't see in the front, right? You got to present all sides of the picture, and that means there is an effect of visual density. Even on when you transplant the crown, oftentimes it can look denser from the front view. The point that a lot of people forget about is when you see someone balding from the crown, you can see that effect even from the side view, looking down like this. So it is important. Of course, the back view is the obvious thing. Who is a candidate? And this is really another advanced topic, and part of it is not just the technical difficulty of creating a crown. It's making a situation where you may have an advancing hair loss where at the end you have this weird patch in the middle because it takes so many grafts. You heard a great lecture from Steve yesterday about how difficult it is, potentially how many grafts it takes, and you may run out of hairs. So it is a very advanced topic for that one reason. So who is a candidate? For me, general guidelines, I don't always follow this. I have operated on patients younger than 35. I'm just giving you some general ideas. Also, I try to have patients understand that the front oftentimes can be much more aesthetically powerful, and then a comb over looks bad, but you can comb hair over the crown. So there are ways to make fewer donor hairs go a longer way by doing this. And then understand that if at least to try to look at a medical therapy as either a first line or as a supplement to what you're doing, because if you don't stabilize that area, you can potentially have problems, and you can regrow a lot of hair with medical therapy. And always understand, this is something that will take time, is a donor to baldness or recipient ratio. If your donor hair is incredibly lush and thick and you've got a slightly older patient, smaller crown, that's a great situation. You got a wide open crown, horrible donor, young age is the worst ratio that you can have. And understand that oftentimes crowns simply don't create the visual density like in the front, even when you put a lot of hairs there. Could be blood supply, could be the way it splays open. We'll talk about that. Ziering has written some different ways of understanding different patterns that exist in nature. This is really just for you, nothing that's going to affect your surgical, but just understand that what exists out there. Crown hair loss patterns, you always want to look, when I look at the crown, I always look below the crown, looking if there's an area in what's called the coronet that it goes even in the donor, can affect the donor area. Biener's talked about the billboard effect because remember what I told you, the vertex is on the posterior side of the head, so it's the vertical portion, so you're looking straight at the naked scalp. What is baldness? Seeing scalp. And if you look at it head on, it's much harder to cover. Also, the crown splays open like this. So when it splays open, it's much harder to cover that versus when all the grafts are moving in the same direction. So you got to plan the donor area. As I said earlier, you have to look for an area that could be problematic, which is that little coronet pattern, and plan below that area. So this is just showing a strip. In general, when I do crowns, I'm not a big fan of doing FUE into the area, although I have done FUE, and I'll show you some examples of that at the end. But the problem with FUE is it takes so many grafts to the crown, and you're moving really into the unsafe donor area oftentimes. And so I know FUE is a sexy term in the media, but I think if you are good surgeons and you are able to do both FUT and FUE, you can give the right technique to the patient rather than having to do everything through one technique because that's all you do. So when you plan the area, remember that when you wet the hair, there's areas that are miniaturized, and especially if the person is younger. So if you have an older patient, you could be more conservative, but you actually have to be sometimes more aggressive on a younger patient because they're going to bleed into that area over time, especially if they're not on medical therapy. And I would be very careful. I know you can't hang your hat on medical therapy, but if someone says, look, I'm not going to do medical therapy, I'm even less likely to do their crown because I'm truly worried. So there's so many variables. You have to think for the patient 10 years to 20 years from now. Most patients, if I ask all of you, think of your current age and add 10 years and visualize yourself in 10 years, you say, that's an old person, right? But 10 years ago, you didn't think you're old now. So people cannot conceptualize themselves 10 to 15 to 20 years from now. It is your job to think about that time period for them, even if they don't care what they look like in 10 years. They'll tell you, I don't care what I look like at fill in the blank. If they're 50, I don't care what I look like at 60. Well, what do you think they're going to care like at 60? Okay, I'm turning 50. I care what I look like. I didn't care at 40, perhaps. I don't know. Maybe I don't care what I look like at 60. I will when I'm 60. So the female crown I talked about, there's all different shapes, all right? But I just reiterate the point that I had in the last one. So I want to talk a little bit about design, because again, that's the thing that I love about doing hair restoration. It's not boring, it's actually design. So these are just sub-components of the crown. So there's a central whorl, and then anything above the whorl I call the upper arc, anything below the whorl I call lower arc. These are just arbitrary terms. The vertex transition point or vertex transition zone is just that point where it goes from vertical to horizontal, sort of the posterior mid-scalp where that junction is. So when you first think about that circle going on. Remember I told you that when you are bridging that area, the transitions are smooth. There is no abrupt change. We talked about that on our first day. So look at where things just gently arc in shape. So how do you design a crown? Well, you follow the natural ghost hairs that are there. Unless he's pretty much bald, then you have free reign to design it. So my preferred design for someone who combs his hair this way with a right hand, with the left part, is this design, which is a clockwise whorl looking at the patient from behind. Why is that? Because the part goes up and the hairs arch over and cover the part better, and they follow the direction of the comb. And if you sort of divide it even further, you can sort of understand that the final component I didn't mention is that I like to put the whorl way up high, because on the vertical scalp it actually cascades down and drapes over even some miniaturized hairs. So I hope that makes sense. So this is striking three benefits by placing in a completely bald area the crown of the whorl up top left if you're looking at a patient from behind, if they're parting from left to right. The other thing here is sort of prioritizing how we're going to put density gradients. Well, if you see 1 and 2 priorities, that's because all that hair comes down and cascades over and covers up the rest of the bald hair. So every hair that's up here travels this distance, every hair down here doesn't travel that much. But one caveat is don't get sloppy where you're putting all this density up here and nothing down here, because I told you this. It's got to be a smooth, gradual transition. So it's a mistake where if you heard this lecture and go, I'm going to put everything up there and nothing down here. No, it's going to look weird. You have to blend everything. So these are just different types of whorl patterns of different shapes, and how I prioritize each of those areas. This is all in the textbook in volume 1. So these are just different ways I prioritize things. Graft sizes, again, that's another way they're like paintbrushes, right? Besides density gradients, you can also use different size grafts. Oftentimes you don't have 4-hair grafts, and oftentimes you don't separate those from 3s or 2s, but I like to make those denser grafts that are going to bulk flow over the crown to create that leverage. Does this mean every case I do this? No. That's the creativity. I'm just giving you creative thoughts. That's the fun part, is if I give you the tools of thinking, you can become a more thoughtful, creative surgeon. So these are just the different sizes. I use basically probably like an 18 gauge for the whole thing. But again, you can use chisel blades, you can use all different things. These are just different patterns, counterclockwise right-sided whorl, etc., clockwise left-sided whorl. There's just all different ways, and if they've got hair there, I don't go chop through their hair unless it's almost gone. Then I design what I want. So remember that I talked about angles, is that you want it to gradually go up and down. I like the higher angles in the crown for the following reasons. Number one is it actually helps me create that rounded profile that I'm trying to achieve. The second thing it does is it provides better density, because when they're splayed in a rounded whorl pattern, if you put very low angles, they compete underneath the skin for space. But if they're more vertically oriented, I can get them in a tighter pattern and thereby create better density. So this is just a schematic model of a crown pattern to show you this. And then this is not meant for you to copy what I've written here. It's just here again to show you how fun and creative design can be. So that's all these little designs are, okay? So you heard a little bit yesterday about positioning for hairline mid-scalp. I like the patient sitting down. No, I usually don't do a procedure in a suit. And this is how I like to position the patient in the crown for the upper portion. And then sometimes I'll have them change positions to get access to make those sites a little bit more easily. So I now oftentimes do what's called a mega session of 3,000 plus grafts over the front to back, and then come back and touch up what's not there. Don't do that. Okay, please don't start doing that. I will have a heart attack if I hear your first case, your first few years of doing that. So I would do the front first, and then maybe do the crown down the line when you get more advanced, then come back and then touch up on a third session. You say, well, 3 sessions? Sometimes yes. So here's just some examples. The clockwise whirl. You can see from the profile view how it improves the roundness there. This is a gentleman that has a slot deformity from the old days of scalp reductions where he did not have a triple flap. This is a single session correction just to camouflage, make him look better. When someone's on finasteride, there can be different, sometimes unusual hair loss patterns that I've transplanted. This is the diffuse pattern for females. This is a more aggressive, more extensive female crown loss. You can see using finer grafts still create a good visual impact in this patient. When you have a hair loss pattern that has basically just most of those grafts going forward in the crown, that's great, because then there's greater visual density than ones that have to be splayed all the way around the dial of the clock, if you understand this. This is a FUE plug correction. You can do this with strip, but this is just showing how you can leverage those. Yeah, I didn't remove any of those. I just used those for visual density and covered them up. PRP and A-cell, you can hear a great lecture from Dan later today about that. But this is a great technique as well. I end this part of my talk, we have one more, on really, again, emphasizing this every time. What is fun about hair is that it is creative.